Hello everyone, my name is Dalia Nessim. I'm an occupational and environmental health science physician and an assistant professor here at the University of Texas Health Science Center at Tyler. I would like to welcome you to another episode of Walk with the Doc. August is already upon us, and most of you are thinking back to school and are starting to prepare your kiddos' return to school. Your children might be returning to online or virtual learning, might be going back to school for limited in-person attendance, what we call the hybrid model, or maybe going back to full physical attendance. Whatever your situation is, today I would like to share with you some tips to help keep you and your children safe during these difficult times of the pandemic. Most importantly, keep your children home if they're sick. Follow your child's pediatrician's instructions on when to return your child to school. Equally important, teach your children proper respiratory etiquette, which is covering their sneeze or cough. Your child should cover their cough or sneeze by a tissue. They should immediately throw the tissue in the nearest trash can and wash their hands by soap and water. If a tissue is not available, they can cough or sneeze into their elbow, but not into their hands. Help your children develop good hand washing skills. Children should wash their hands frequently with soap and water. After coughing, sneezing, or blowing their nose, after playing outside, after touching any potentially contaminated surfaces, after using the restroom, or before eating. They should wash their hands with soap and water for at least 20 seconds. An easy way for them to remember this is to sing the happy birthday song twice while washing their hands. If soap and water are not available, they can use hand sanitizer containing at least 60% alcohol. Discourage the sharing of items like books, stationery material, electronic devices, or toys. Label your child's belongings, and they should be separated from other kids' belongings by individually labeled containers or cubbies. Talk to your children about social distancing and how they should follow their teacher's instructions and be where they need to be. Tell them to avoid physical contact with their teachers and with each other. It is recommended that your child wear an age-appropriate face covering. Consult with your child's pediatrician about whether your child could wear one. Face coverings can be cloth masks or disposable ones. Teach your children how to properly put on and take off a face mask, and that they should not touch the outside of the face mask, and to wash their hands if they do. If your child is in a high-risk category, meaning they have a pre-existing condition like a congenital or chronic disease, consult with your child's pediatrician whether your child can physically return to school and the appropriate measures and precautions if he or she can do so. If your child is returning to exclusive virtual or online learning, please supervise your child in the process. Organize your child's schedules, including his or her screen time, so that they wouldn't have excessive screen time. And make sure that they still spend adequate time outdoors to exercise and stay active. Also remain aware of the websites visited by your child and activate parental controls if needed. Communication is key during these difficult times. Make sure to talk frequently with your children and be available to answer all their questions in an age-appropriate manner. Communicate frequently with your child's teachers, school staff, and pediatrician. Talk with them about any concerns or questions you might have. Last but not least, strengthen your child's immune system. Make sure they have a healthy lifestyle by eating a nutritious diet, having adequate exercise and sleep, and finding time to unwind, while staying away from stressful environments and situations. Also make sure that your child is up to date on their vaccinations. I hope these tips help you and your child prepare for the upcoming academic year by a safe return to school. Stay healthy and safe, and have a happy fall. Thank you.